Over 100 million Americans suffer from some form of addiction, and thus far, the medical community has had trouble finding a way to treat it, with close to 90% of addicts relapsing within a year. But in his new book, The Addiction Solution, Dr. David Kipper discusses the true science behind addiction and how we must change the ways we think about it and treat it. Dr. David Kipper is here today to tell us more. Dr. Kipper, thanks for being here.
Good morning, Tanya.
Why has addiction been so elusive? It's been so hard to treat.
First of all, we have this horrible recidivism rate, 90% treatment failure with this disease, and this statistic has been there for over 100 years. So something was missing, and it became clear to me that in treating this disease that we were missing a very important element to this. And in the last 10 years, science has shown us through the cracking of the genetic code, through the discovery of these neurotransmitters and these receptors, that the basic science to this has now categorized this disease as a chronic medical disease based in brain chemistry. And there are three basic neurotransmitters, serotonin, dopamine, and noradrenaline, that control our behaviors. And it's this imbalance in these transmitters that starts off the process of addiction.
So you think there's been a huge misconception about addiction, that it's more behavioral rather than an actual scientific fact?
Traditional treatment has looked at this disease as a behavioral malady, but if that was the case, then all these behavioral therapies should have worked. So 90% is 90%.
Absolutely. So now we know that it's a little bit more complicated than that. It's a combination of factors, is that right? Genetics play a part?
It's originated in brain chemistry, it's determined by our genetics, and it's triggered by stress. It's a pretty simple mantra. And again, the transmitter receptor issues in the brain have really given us the big missing link in how we not only diagnose this disease, but how we treat this disease. So the treatment options now are vastly different, and people now can reverse that 90% failure rate and flip that statistic pretty much close to that percentage, as long as people are willing to change their behaviors and comply with a chronic medical treatment.
So are we seeing that starting to happen, that addiction is actually, people are actually beating it?
The answer is yes. The simple answer. The complicated answer is that very few doctors treat this disease, and that's part of the problem also. Less than half of 1% of doctors treat addiction, 10% of medical schools, only 10%, train people in addiction. So we don't really have the resource. Now that we have all the scientific information that we need, we don't have the resource to go ahead and treat this. But there will be a shift in this paradigm.
Right, and there are promising treatments, chemical treatments, correct? Medications that are available now?
They're, again, based in brain chemistry, knowing these transmitters that are responsible for the addictive behaviors. We have very targeted medications that can restore the balance to these transmitters and can take away the cravings and the wantings. And at that point, once people have rebalanced their brain chemistry, then they can be amenable to these behavioral treatments. So it's a combination of both figuring out the scientific or brain chemistry issues, matching that with the individual behavioral issues.
Sure.
And then we have a shot at fixing this.
Right, it's a multi-step process here.
Yes.
Now, I've heard that there is even a medication out there now that can take away the euphoria that an alcoholic, for instance, feels when he drinks alcohol.
There's a medication on the market, it's called Vivitrol, which is a naltrexone product that was initially brought into the market for opiate addiction. Didn't work. And we started giving this to people that had alcohol addictions, and it's an injectable, it's a monthly injectable, and after 2 to 3 months of taking this injection, the cravings for alcohol tend to go away.
That sounds promising.
It's very promising, and that's, again, that's mixed with restoring the imbalance that alcoholics have. Alcoholics tend to have a serotonin imbalance. So by replenishing their serotonin stores, that also goes a long way in taking away their cravings. So a combination of these newer medications. There's a vaccine for cocaine that's being developed, and there's a medication now for nicotine addiction that targets these nicotine receptors that wipes out your craving for nicotine.
It's all very exciting. And we don't have a lot of time, but I want to ask you quickly, because there is a quiz in your book that will help you determine whether or not perhaps you are susceptible to an addiction.
Unlike the book, which is based in science, the quiz is based on my 25, 30 years of treating addiction, so it's more based on my clinical experience. And what it does is that it correlates these chemical imbalances, these transmitter imbalances, with behaviors. As an example, people that have low serotonin levels tend to be depressed, have OCD. People that have low dopamine levels are agitated, unfocused, manic. You take these, so you ask these questions, you find out what their transmitter imbalance is, you restore that transmitter chemically, and people are back on the same page where they can then accept these behavioral treatments.
Fantastic, Dr. David Kipper. Thank you so much. And for more medical news, check us out on the health page at abcnews.com.